Thanks for joining us again today. Let me start with the update on the statistics around COVID-19. An additional 68 positive cases were confirmed yesterday, but that represents just 0.4% of the people who were newly tested yesterday, and it takes the total number of cases now to 20,056. A full health board breakdown will be available as usual later, but the provisional information I have is that 15 of the 68 new cases are in Tayside, where we're dealing with a cluster involving the Two Sisters food processing plant. 21 are in Greater Glasgow and Clyde, 8 in Lanarkshire and 9 in Grampian. The remaining 15 are spread across 7 different health boards. I can also confirm that 257 patients are currently in hospital with confirmed COVID, which is 8 more than yesterday, and 2 people are in intensive care, which is the same as yesterday. I'm also pleased to say that, again, in the past 24 hours, no deaths were registered of patients who tested positive over the previous 28 days, and the number of deaths under that measurement therefore remains 2,494. However, as we were reminded yesterday, people are still dying of this virus, so we must continue to treat the threat it poses very seriously. Every death is, of course, a source of heartbreak and grief to many, so again, I want to send my condolences to everyone who has lost a loved one. There are a few issues I want to briefly cover today before the Chief Nursing Officer and I take questions from journalists. The first is our latest estimate of the R number, which you will recall is the average number of people infected by one other infectious person. Our modelling suggests that the R number is currently between 0.8 and 1.2, which is unchanged from our previous estimate. Obviously, we look at the R number carefully, although when prevalence is generally low, as it is just now across Scotland, it can be influenced disproportionately by the kinds of clusters that we have been seeing lately. However, we've also seen a recent rise in daily cases, although many of them are connected with known clusters. And of course, as I've just highlighted today, our daily testing positivity rate remains low, around 1, or as we've seen today, significantly below 1. However, we are nevertheless being reminded on a daily basis that COVID is still out there, it hasn't gone away, and therefore there is a need for continued caution. And all of us, of course, have a part to play in suppressing the virus and denying it wherever possible the chance to spread. Let me now give a quick update on the most significant clusters that we are currently dealing with. Firstly, in relation to the cluster linked to the Two Sisters plant in Cooper-Angus, as of yesterday, there were 166 positive cases linked to it. 146 of them were workers at the factory and 20 were contacts of those workers. In total, that's an increase of 10 positive cases since yesterday. Virtually all of the workforce have now been tested. In fact, more than 5,000 people in Tayside have been tested since the outbreak came to our attention last Wednesday. And at this stage, there is still no evidence of wider community transmission, which is very positive news. All employees at the factory and their households, of course, should continue to self-isolate until Monday, and I want to thank them and indeed everyone else who is helping us to maintain this outbreak and prevent further spread. Let me also update on the situation at Kings Park School in Dundee. In total, now 34 cases have been identified as part of that cluster, which is 3 more than yesterday. Of these 34 cases, 21 are staff members, 10 are contacts and 3 are pupils of the school, all from within the same class. All staff, pupils, household contacts of pupils and other relevant contacts should now be self-isolating. And again, in this cluster, there is no evidence at this stage of wider community transmission. There's also a cluster of cases in Hawick that we're dealing with right now. 7 positive cases have been confirmed there so far. All of them are from a small number of families in the area. Control measures are being put in place at a number of workplaces linked to those individuals, and the process of contact tracing is underway. Close contacts are being tested, and a mobile testing facility in the area will support that process. And finally, in relation to the outbreak in Aberdeen, there are now 263 cases associated with the pub cluster. That's an increase of 2 since yesterday. All of the signs continue to be that this outbreak is now under control, and so again I want to thank everyone who's played a part in achieving this. I want now to say a word about recent testing numbers, and particularly, and I hope this is helpful, give you an insight into the testing of children and young people since schools returned recently. We know that in recent weeks, the number of children and young people under the age of 17 who have been going for testing has increased significantly. Based on management data that we've got from Public Health Scotland, we know that it has in fact increased 8-fold since the middle of July. Last week alone, just short of 17,500 young people aged between 2 and 17 were tested. That is a very significant number. But the key point I wanted to make and to share with you today from that is this one. Of those almost 17,500 young people who have been tested or who were tested last week alone, only 49 of them tested positive. So that's a positivity rate of just 0.3%. Now, I know and I can well understand why many parents and teachers and young people themselves have concerns about the return to school. And yes, we've had clusters of cases in some communities involving young people. But I think these figures reveal the bigger picture. Despite an increase of more than 300% in the number of young people that were tested from 1 week to the next, from the week before last to last week, the number of positive cases recorded increased by just 2. And that's not 2%, that's just 2 in total. So I think that is encouraging, and I hope it's reassuring to parents and to teachers across the country. And I hope it will encourage you to absolutely continue to be vigilant. We all have to be vigilant right now, but not to be unduly concerned about young people in schools. And while it's understandable that people, parents in particular, want to err on the side of caution, it's also important to remember the symptoms of COVID that trigger the need for a test. These are any one of a new persistent cough, a fever, or a loss of or change in sense of taste or smell. Other symptoms, like a runny nose, if they are not accompanied by one of the COVID symptoms, should not lead to a test. So I hope the data I've just reported provides some additional assurance as the school term continues. We will, of course, continue to closely monitor these results over the coming weeks, and if there are any changes that I need to bring to your attention, please be assured that I will do that. But I thought it was important to give you an insight into this information today. Now, the final item I want to cover today concerns restrictions on social gatherings, and this relates to an announcement I made last week in Parliament when I gave the 3-weekly review update. And I can confirm that from tomorrow, police will have powers to disperse house parties if more than 15 people from more than one household are in attendance. We know from the reports of Test and Protect and also from evidence around the world that these kinds of gatherings pose a significant transmission risk. Under the current guidance, of course, no more than 8 people from a maximum of 3 different households should be meeting indoors. The vast majority of people will be, I know, sticking to these limits, and I'm grateful for that. But we know a minority don't. And of course, as we head into autumn and winter with the colder weather, the temptation to hold big indoor gatherings will understandably be even greater. Now, the higher limit, 15 as opposed to 8, that we set in this new law are not a green light. I want to stress this, to ignore the existing guidance that a maximum of 8 people from 3 households should meet indoors. But in recognition that we intend these new legal powers to be a last resort only and for use in the most blatant breaches of the guidance, we have decided to set a higher threshold for their use. Ensuring that police have the powers to disperse large house parties where that is necessary is another important tool in trying to keep this virus suppressed, and we hope it will help to reduce the potential for future clusters and outbreaks leading to greater lockdown restrictions having to be imposed. As I've said already, we expect these powers to be used only as a last resort, as all of these legal powers we've deployed during this pandemic have been a last resort. And the restrictions will only be in place so long as they are necessary. We will review them every 3 weeks. I also want to make it clear, particularly to young people, this is not about trying to stop people having fun. We're not trying to police your social lives. Seeing and socialising with your friends is important, especially during what continues to be a really difficult period. But for the overall health and well-being of the country, it needs to be done safely and responsibly, because that's how we will avoid the return to some of the stricter lockdown measures, and it's how we will continue to keep this virus under control. And of course, we all have a part to play in this, so I'll end as always by stressing the importance of the facts advice. The recent rise in prevalence and, of course, these clusters we're seeing in different parts of the country show us and remind us how quickly and easily COVID is capable of spreading. So we all need to do everything we can to avoid that happening and keep it under control. And that means complying strictly with the guidance on social gatherings, but fundamentally it means in all of our day-to-day interactions continuing to follow the 5 golden rules of facts. So let me just end by reminding everybody what they are. Face coverings in enclosed spaces should be worn. Avoid crowded places, indoors or outdoors. Clean your hands and clean hard surfaces regularly. 2-metre distancing is the overall rule that we're asking people to abide by, and self-isolate and book a test if you have any of the symptoms that I've already spoken about today. If we all comply with these rules, then despite the challenges we are seeing as we come out of lockdown, we do give ourselves a real fighting chance of keeping this virus under control. So all of you who are watching, I suspect because you're watching, you are taking care to comply with all of this advice. Please continue to do so, and please, as I regularly say now, please help us in getting the message across by spreading it to everybody in your family, your friends network, and of course colleagues. So my thanks to all of you for joining us again today. We're going to move now straight to questions. Chief Nursing Officer will assist me with the questions today, but we'll move firstly to Gillian Sharp from BBC Scotland.
Hello. The UK government is piloting a scheme in England in local lockdown areas to pay £130 to people who have to self-isolate. This is to help reach more contracts through track and trace. Now, the level currently stands at 80%. Would you consider a similar scheme in Scotland? And what's the current level of contacts being traced here?
I reported on the figures through Test and Protect last week. We have got a very high percentage of contacts of positive cases being identified through Test and Protect, and then their contacts being traced, over 90% in both cases. And we're not complacent about that, but it is a real tribute to those working in Test and Protect. On the issue of support for people who have been asked to self-isolate, we have been encouraging the UK government to put in place support. We are, as we speak, ascertaining the details of what I understand is a pilot that has been announced in England today. How that is going to be paid, it seems to me to make sense for that to be administered through existing welfare or benefits systems, and obviously we're seeking to understand what the financial consequential position is for the Scottish Government. So as we have more details, that will allow us to base decisions of our own on. Colin White from STV.
Just wondering what you make.
Sorry, Colin, your sound's gone.
Just wondering what you make of the latest homelessness figures, which show a rise in homeless households. Some of the figures are among the highest on record. They don't really take into account the lockdown and the situation with COVID, but would you expect next year's figures to be even worse? And what can you do to try to alleviate the situation as we come out of the pandemic?
Well, the figures that have been published today, largely not 100%, but as you rightly say, Colin, largely predate the pandemic. Any rise in homelessness is a cause of real concern and worry to us, and obviously we have seen over recent times real pressure on benefits and the welfare system, which is in some respects part of what drives these things. We have been working hard. We had the task force on homelessness and rough sleeping that made a number of recommendations that we are in the process of implementing. We have invested additional resources to, for example, scale up the housing first approach and working towards eradicating rough sleeping and homelessness. Obviously, we've taken particular steps with local authorities during the COVID pandemic that has helped to get people out of rough sleeping situations. And one of the things we are looking to do now is embed some of the measures that we're taking during COVID to make sure that they are longer lasting and that we don't slip back the way. So in answer to your question, what would we expect to see in next year's figures? We will be doing everything we can within our powers, within our resources, and within the redesign of homelessness, the approaches we take to homelessness and rough sleeping, to make sure that we don't see further increases. But of course, we cannot be complacent about that, particularly in light of the figures that we've seen today. Peter McMahon from ITV Border.
Thank you, First Minister. Could I ask about the Hawick cluster that you mentioned in your introductory remarks? It's obviously a relatively small cluster by comparison to others around Scotland. Are you now satisfied that it's been contained? And you mentioned also there was a mobile testing facility. Is that specifically for people who might have come into contact with people, or is that more widely available to people in the Hawick area who might fear they've been in contact with someone?
In terms of the first part of your question, the local teams through the IMT are working hard to make sure that everything possible is being done to contain any further spread. I think it is probably premature, given that this is a relatively new outbreak, for me to say here that I'm confident that there will be no further spread. I think we will have to wait and see for a few more days before expressing confidence. But I'm certainly hopeful on the basis of the information I have just now. In terms of the mobile testing facility, obviously the use of that will be directed by the IMT based on what they think is required to most effectively limit spread. Obviously, the priority around testing in these outbreaks is clearly people with symptoms, as it is everywhere, and testing of close contacts. But in other outbreaks, I'm thinking particularly of the one in Gretna, which was the first sort of outbreak we had in Scotland as we started to come out of lockdown, testing was offered more widely to people in the local community. But these decisions, it's important that they're based on the tactical judgments that the local IMT take. And of course, they will keep the local public updated on developments as they think appropriate. Phil McDonald from Global.
Thanks, Mr. Minister. What preparations were made for a potential surge in demand for testing as children got ready to go back to school? Obviously, we're seeing people being told to go to England again today for testing. That's the second time in the space of a week.
In terms of what preparations were made, we've been steadily building capacity for testing in Scotland throughout this whole pandemic. And just to give a bit more detail, when we talk about capacity for testing, there's really two key elements to that. There's what we call sampling capacity, the ability for people actually to have the test taken, and then there's laboratory capacity, which is the ability to process the test and get results. So we've been building that capacity. We also have contingency plans, some of which we're activating this week in order to deal with spikes in demand. But just to give some context, and obviously this is information that is published regularly, but yesterday there were almost 30,000 tests carried out in Scotland. If you think back a few weeks, I was regularly being challenged here by journalists and opposition politicians on the fact that our daily testing level was about 4,000 or 5,000. So we have not just planned to scale up testing, we are delivering significantly more tests on a daily basis. The last few days or last week or so have been probably the first period since we have significantly scaled up that demand that it has come under pressure. So we need to, as you always have to do when you're dealing with these things in a real-time basis, you have to look at how we respond to those. There's a couple of issues we've encountered this week, and I should say the significant part of our testing is delivered through the UK-wide testing system, which allows us to deliver economies of scale, so it's the right approach to take. But it means that we have to manage, this is managed on a UK-wide basis in some respects as well. We've had some technical issues this week, there is work ongoing to resolve, and that is the system referring people in Scotland to testing centres outside Scotland, which is being resolved, I hope, in a technical sense. There's also about, in Scotland, making sure not just that we have overall capacity that meets demand, but that we're able to flex it so that if there is higher demand in the central belt, while we've got spare capacity in Inverness, obviously that's not ideal. So we need to make sure that we can not just have the overall capacity, but flex that geographically as well. That are also reflecting the fact that this is a UK-wide system. We are also, particularly I think over the next few weeks, seeking to make sure we understand with the UK government, and we're constructively discussing these kind of issues with them at an official level, to make sure that the ways in which demand is managed across the UK doesn't in any way disadvantage Scotland within that. So there are some practical challenges that we're dealing with right now as we continue to build the resilience and the reliability of this new system. And anybody who's had difficulties booking a test, obviously, we're sorry for that, and bear with us while we make sure that we continue to build this system. But don't lose sight of the fact that we are delivering right now a volume of testing each and every day that is significantly higher than at any point up until now. And the figures I've given you both in response to this question, but also the figures I gave you in relation to testing for younger people last week alone shows the scale of the testing that we are now doing. And, given that we're going to be in this pandemic, unfortunately, for some time to come, then we have to continue to build both the capacity, the flexibility and the resilience of this system, which will involve sometimes, and I've always tried to be frank about this as we've gone through this, that we will, we're doing some learning as we go around this. So there will be changes and tweaks that we have to make if things run into some challenges, as with the testing system has happened on some occasions this week in the ways that I have set out. Ali McGilvery from Bauer.
Thanks, First Minister. In terms of allowing people back into sports stadiums, yesterday our listeners on Radio Click heard from the Scottish Football Supporters Association, who described the decision to allow a test event at a rugby match but not a football match as preferential treatment. Can you understand why some football fans might feel like that, and can you explain to them why that's not the case? Is it because, for example, if Celtic were to be given the go-ahead, you're worried that could upset other teams?
No, that is not the case. And of course, I understand the frustrations many people in many different walks of life are feeling right now, because life isn't normal and we're all really anxious to get life back to normal. But let me just be clear what we're doing here with these trial events with spectators back in stadiums. We're not trialling how it works in rugby versus football. I'll let you into a wee secret here. The virus doesn't care about the shape of the ball at these events. What we are testing is how we can operate within a stadium with spectators and maintain and comply with all of the physical distancing and other hygiene rules. So the learning from rugby will apply to football, because, as I say, it's not specific to rugby versus football. The virus really doesn't care what sport it is. It just cares about having people to transmit from one to the other around. So the test event that will go ahead tomorrow night at Murrayfield with rugby will allow us to learn and to apply those lessons across different sports. And hopefully in the not too distant future, we'll be able to move into having, albeit limited number of spectators in stadiums for a whole variety of different sports, not on a test and pilot basis, but on a more general basis. I would ask spectators and fans, whether it's a football or rugby, to bear with us just now. We're trying to find the safest ways of getting as much normality back as possible. It's not about preferring rugby over football or football over rugby or any sport over any other sport. It's just about trying to keep people as safe as possible as we try to get life back to as much normality as possible. Tom Eden from PA.
Thank Thank you, First Minister. Good afternoon to you both. A couple of questions about our cultural sector, if I may. There was £97 million worth of consequential funding announced in July. Various MSPs are saying that only a quarter of that has been allocated thus far, but organisations representing parts of that sector are being told that there's no money available because it has all been allocated. I was just wondering if you could shed any light on what the truth of that is. And then on a similar note, the indicative date for indoor music venue performances is mid-September, I believe. Is there not a bit of a glaring contradiction that these same venues will not be able to play background music or have volume on the TV?
I don't know if you were listening to First Minister's questions yesterday, Tom, but I made, I think, unless my memory is really playing tricks on me, I think I made some comments about the £97 million consequential. Some of that has been allocated, but we have been consulting on the allocation of the rest, and we will announce how that money is going to be allocated very soon. I know the Culture Secretary has been looking at some proposals in the last day or two, so that is money yet to come, and we want that to help as many venues and people in our arts and culture sector as possible. There's been particular understandable issues raised around the comedy sector recently, and we hope that the allocation of these funds will provide some much needed help there as well. So those announcements are yet to come. On music in pubs, which is I think what you were asking me about, which again, it's a bit like my answer to the question about trial events in sport. None of what we're doing right now is ideal, but we're trying to get things back to normal while keeping the risks of transmission as low as possible. We know that when people are shouting or speaking more loudly to be heard over music, then that creates more aerosols, so can potentially increase the risk of transmission. So we are trying, in order to get pubs open, as one of the things we're doing to try to lower the risk of transmission, is keep that at a lower level. But we said when we announced that, we said we would talk to the sector about whether actually there was a certain decibel level that it was safe to have. So these things are not set in stone. We will continue to discuss and adapt and try to introduce as much normality as possible. But one of the key fundamental points I keep making here, which we can't lose sight of, we'll reach tipping points in all of this. And if we reach a tipping point where we do so much and return to normal, which we are all desperate to do, but return to normal to the extent that the virus runs riot again, then we'll be back to square one or something close to square one. So this is a really difficult balancing act. I'm trying to be, as I've tried to be all along, as upfront with people about the judgments we're making. Yeah, you can look at all of these things right now and pick out inconsistencies. And inevitably there will be some, but this is all about trying to avoid getting to a position where the cumulative impact of what we're doing is just too great and sets us back. So we'll continue to try to reach these decisions in as balanced and careful a way as possible. Do you want to say something, Fiona, about transmission risks, particularly around aerosol? Or,
I think it's difficult when it's inside as well, of course. And the difference between music at venues is that people are hopefully there to listen to the music, and the background music is there as background, which we do understand in terms of the ambience and the whole experience for people, particularly dining. I think it's perhaps easier in terms of decibel levels rather than pubs. But it is that you're making sure there's social distancing, not having to lean in when there is that loud background noise, and trying our very best to minimise the opportunity for the virus to be transmitted between more than one person, and as we've seen already, how easy that can be.
Vivian Aiken from the Daily Record.
Good afternoon, First Minister. We saw again this morning pictures of crowded corridors in schools, people crowding in during lunch breaks and morning breaks. On the other side of the coin, we see people in some other schools who are being kept outside in the pouring rain because of the fear of people crowding in corridors. What kind of advice would you give to head teachers or local authorities who are sort of tossing the coin between in or out? What should they be doing for children in the bad weather?
We've given guidance, and individual head teachers schools come in different shapes and sizes, obviously, so individual head teachers also have to make judgments based on the physical layout and the physical capacity of their school. We've given guidance to help with that where we see. I haven't seen pictures of that this morning, but as I've said before, where we see anything like that, we'll engage with education directors and local authorities so that they can better support schools. And I know there was there's been one concern or a concern raised about one school. There may be more where kids were kept outside in inclement weather. Clearly, the overall, and head teachers know this better than I do, their job is to keep children safe and to balance these different things. And they have to make those judgments based on the physical characteristics of their school. And I think the vast majority, I think all head teachers and all teachers are doing a really good job in doing that. Obviously, we want children to be outside as much as possible when they're not in the classroom, because it's good for them to have fresh air, but also reduces transmission risk. But nobody expects children to be outside in gale force winds. So these schools will have to look at the practical arrangements they put in place with as much support as possible. And obviously from Monday in corridors in communal areas, because we recognise there that there is a greater difficulty in physical distancing, there will be the requirement in secondary schools for young people to wear face coverings. Christine Lavelle from The Sun.
Thank you, First Minister. It was just on the issue of when children should be kept off school. NHS Lothian have said in guidance that kids should be kept off if they have a runny nose, although there's reports today that may change. However, there's no such rule in Greater Glasgow and Clyde. And I just wondered, is that not sowing confusion, and would it not be better for there to be clear national guidance?
Well, there is clear national guidance. I stand up here every day and I communicate it to those of you who are still watching. I'm not going to stand here and advise parents individually on when they should keep their children off school. There will be a whole host of non-COVID reasons that existed before the pandemic why a parent will make a judgment on a daily basis not to send their child to school. But what we're talking about here are the COVID-related reasons, and those come down to the symptoms that I remind people of every day. So if your child has a new continuous cough, if they have a fever, if they have a loss of or change in your sense of taste or smell, then they shouldn't go to school and you should get tested. And that, of course, is the same for the adult population. These are the symptoms that we're asking people to act on in a sense of getting tested. So that is the COVID advice. If your child has a runny nose, then there's not a COVID reason to keep them off. A runny nose with none of the COVID symptoms, there's not a COVID reason to keep them off school, and there's not a COVID reason to get them tested. But of course, parents will make judgments based on whether the runny nose is causing their child to feel unwell about whether or not they keep them off school. But that's not related to COVID. Parents have been making these judgments from time immemorial before this pandemic. But the advice on COVID is clear, and if there is any sense that health boards have inadvertently given advice that departs from that, we will engage with them in order to make sure that there is that clarity. Do you want to add anything on that?
I think as the First Minister says, parents are the best ones to make a decision, is their child fit for school or not. And the normal, pre-COVID, if your child wasn't well, you would keep them at home, and you can obviously phone GP surgery to get some advice for that. And that should continue. And as the First Minister says, the COVID symptoms, absolutely staying at home and phoning up and getting a test. But parents should trust their judgment and be confident about when to keep their children at home because they're not well, and when they feel that they're well able to go to school.
Tom Martin from the Daily Express.
Hi, thank you, First Minister. Just looking ahead to the forthcoming programme for government, given the recession we're in and the mounting unemployment figures, inevitably people will be looking for more action in terms of the economy. Without preempting any details, how much attention can you give to this area? And as well, obviously a lot of legislation's held over as a result of the pandemic. And what difficulties do you have in juggling things?
I'll set out the programme for government in Parliament next Tuesday for reasons you well understand. I'm not going to preempt any of the detail of that because the presiding officer would not be happy if I did so. Clearly, the economy will be central to that, and building recovery from COVID will be central to that. But beyond that, the details, I'm afraid you're going to have to wait until Tuesday. On the legislative programme, yes, we've had to constrain what would normally have been our legislative programme for this year. So it will be more limited than would otherwise be the case. But also we are heading into the final parliamentary session before the Scottish election next May. So there will also be a smaller legislative programme because of the stage we're at in the parliamentary cycle. But the details of that will all be set out to Parliament next Tuesday afternoon. Tom Gordon from the Herald.
Hello, First Minister. Can you hear me?
Mm-hmm.
Today, like every other day, you've talked about numbers of people in hospital, numbers of people testing positive, numbers of people in ICU. And you've done that without naming them, without identifying them, without reference to their case histories. Given you do that every single day, can you tell us now when you knew, without identifying people, but when you knew as a matter of fact, that some patients who had tested positive for COVID had been moved into care homes? I'm not asking for names, case files, identifying information, just when you knew that to be the case.
I don't have that information, and that's why we've asked Public Health Scotland to not just look...
You didn't know that before the Sunday Post reported it?
We have asked Public Health Scotland to do the analysis that gives us the information that people are asking for. So if patients were discharged from hospital into care homes when they had COVID, if that is the case, then whether in those cases they were discharged after they had recovered from COVID, or whether they were discharged into care homes when they had COVID. If in the latter situation, what were the reasons for that? Was there a clinical rationale for that? Now, we are, I think, the only government in the UK that has commissioned an in-depth analysis of this that will enable us to provide that information in full. And I actually think that is the right thing to do. I am not party to clinical decisions that are taken. And that's not about, Tom, before you come back in, that's not about naming people. That is actually not being party to any of the clinical decisions that are being taken. But I want to understand the decisions that were made over the course of this and what the implications of those might be, so that we can be accountable for that, but also so that we can learn any lessons. That Public Health Scotland analysis, we have asked for that to be complete by the end of September, and that will be set out to Parliament, and you and others can scrutinise that, and you can ask lots of questions about it. But it is important for us to do that so that I have the understanding and I can share that understanding with others. Conor Matchett from the Scotsman.
Thank you, First Minister. Just returning to the powers that you're about to give to Police Scotland tomorrow. I'm really just interested for more detail on how this is going to be enforced, because I think many people will understand that there might be house parties of 10 or 11 or 12. What do the police do if they're called to a house party with that number of people? What powers do they have? And secondly, are you encouraging people in Scotland to become a nation of curtain twitchers?
No, I'm really not. On the enforcement, the police are well able to proportionately and sensitively enforce these regulations as they have enforced all of the other regulations around COVID. And, the police will, if they come across, I'm sure, and, the Chief Constable actually at a previous stage in the pandemic stood next to me here and talked about how they had dealt with house parties when we still had the stay-at-home guidance in place. So if the police think there is a gathering in a house that is breaching the guidance, and remember the guidance is the 8 and 3, 8 people from 3 households, they will no doubt, if they have an awareness of that and if they have a requirement to engage with that, they'll encourage people to comply with the guidance and disperse, and that will be the case if it's 8 or 10 or 12, if it is over 15, and as a last resort, if people are refusing to follow the advice and comply voluntarily, then the police will have powers to enter and disperse. But, you know, just as all of these powers have been used by the police really sparingly and as a last resort, I'm pretty sure that will be the case with these as well. But it's important there is that backstop, because we know that in a minority of cases, these, you know, flagrant breaches of the guidance will lead to transmission of COVID. So it's important that they're there as a backstop. But I have every confidence in the police using these very sensitively, very proportionately and very sparingly. And I'm sure the Chief Constable will himself, rather than have me do it here just now, will set out the approach that the police will take to that. Derek Healy from the Courier.
First Minister, the Health Secretary has confirmed information is not currently held on the number of people who have brought coronavirus into Scotland since quarantine measures were introduced. The Lib Dems have suggested this information is important to track how well measures are working and what countries pose a risk. Can you say why that information isn't being tracked? And are there any plans to begin doing so? And also, just very briefly, on the point of this rise in young people getting tested versus a low number testing positive, does that illustrate a level of nervousness, do you think, among young people and their parents in the current setup?
On the first question, we didn't actually, scientists doing this work at an earlier stage, based on the genomic sequencing work they had done, gave details of the number of importations of the virus that there had been, I think, over the February, March, April period. So some of this is not quite as straightforward as you might think. Now, we obviously look at cases very, very closely on a daily basis, so there will be intelligence being gathered on whether people who have cases have had recent travel history, but you cannot then make an automatic assumption that they, in some cases it will be more obvious than others, but in every case you can't make an automatic assumption that because somebody who was, you know, for argument's sake, in Spain a couple of weeks ago and is in Scotland now with the virus, that they brought it from Spain here. They may have picked it up here, and that's where the genomic sequencing work is an important part of robustly validating that kind of information. So we will always look at the information that can reliably be made available from the daily work that Public Health Scotland will do looking at cases. But some of where did a person get coronavirus, it sometimes needs much more scientific exploration than what I've outlined that we do on a daily basis. Is there more you want to add from a clinical perspective there?
Genomic sequence is incredibly important, and that gives us really rich data about where people are coming from and where they're contracting the coronavirus from. Of course, the most effective way of people, if they are coming into the country, not to transmit COVID, when they're coming from an area for quarantine, is to quarantine for 14 days. And that then would mean they weren't transmitting it. Our test and protect teams are very, very thorough. So we know that some of the clusters in that contain people who have been abroad and perhaps haven't quarantined. So it's important information. It's important that people follow the quarantine, and some of the more detailed genomic sequencing does help us understand the way that COVID travels across the world as well as across Europe.
Michael Blackley from the Daily Mail.
Good afternoon. It seems that in England, heads are rolling because of the exams fiasco. The top civil servant in the Department for Education, the latest departure announced. Why is it the case that nobody has paid the penalty for very similar problems here in Scotland? And Boris Johnson said yesterday that there was a need for fresh leadership in education in England. Is there a need for fresh leadership in Scotland too?
No, I don't think there is. I have stood here, I've taken responsibility for what we got wrong with the exams and apologised to young people and their parents, and we put it right. And, you know, that's the position. We took responsibility as ministers. I, as First Minister, the Education Secretary, we chose not to do what perhaps has been done in England, where civil servants have been left to carry the can and ministers have tried to say it's not their responsibility. We didn't do that, and that's our decision, and it's for other governments to take decisions of their own. And I know this comes as a surprise to the Daily Mail on a daily basis, but we take our own decisions on these matters here in Scotland. And what the UK government does is for them to explain and set out and give a rationale for, just as it's for me to do the same with Scottish Government decisions that we take. Emma Seath from Times Educational Supplement.
Hi there, hi. The SQA consultation on changes to the exams and courses this school year ended this week after running for less than a fortnight. Teachers have described the proposals as inadequate, lacking insight and coming too late, and parents have branded them gobbledygook. A key concern for teachers is that despite pupils missing weeks of school during lockdown, no content's been removed from a number of courses, including 3 higher science courses and higher maths. Teachers say that this means this school year will be a cramming year for learning superficial, and that some students will miss out on content and be disadvantaged in the exam. There are also concerns that no attempt is being made to future-proof the qualifications for a second wave of coronavirus. Pushing ahead with the normal exam diet is being described as hopelessly optimistic by the EIS. Such warnings should set alarm bells ringing, given teachers were ignored ahead of this year's results and pupils suffered as a consequence. So is the government listening this time, or are we sleepwalking into another qualifications fiasco?
As you say, this is an SQA consultation that has just closed. You've just read out extracts from a number of, I assume, responses to that consultation. The SQA now will assess all of the responses and put forward their proposals on the back of that. And I think we should probably allow that process to run its course before making judgments about whether it's doing what people want. The only other point I would make at this stage is that it's not for ministers to decide the content of particular courses in the curriculum. That's for the educational experts to do. But I do think, given that the consultation has just closed, that there have been a number of responses made that you've just reflected there, allow that process to continue, allow the SQA to reflect on those responses and set out its response to that and its proposals on the back of the consultation. And lastly today, Tom Magner from Carers World Radio.
Thank you very much indeed, First Minister, and good afternoon to both of you. Picking up on the earlier care homes question and looking at another aspect, the Queen's Nursing Institute has published a report suggesting that the NHS imposed do not resuscitate orders on some care home residents without their knowledge and consent early on in the pandemic. So did the NHS in Scotland do this? If that was the case, did you personally know about it? And if it didn't happen in Scotland, how can you be completely sure that secret DNRs will never happen, no matter what the winter pressure on the NHS?
I'm going to hand over to the Chief Nursing Officer, but I've addressed this question many times in recent months here, that nobody should ever be under pressure to agree a do not resuscitate instruction, and do not resuscitate instruction should never be seen in isolation. It should all be part of a really holistic, person-centred approach to the decisions that people want to make about their end-of-life care. And therefore, these are decisions to be taken on the basis of discussions between patients, families and clinicians. They are absolutely not things that should be dictated by government in any time, whether during a pandemic or at any other time.
And what we need to do is have confidence in our clinicians. I think at the beginning of the pandemic, there were probably some areas that were clumsily handled. We would urge everybody to talk to their loved ones about what they would like to happen at the end of their life, so that it's not taboo, so that it's not a surprise, because often death does surprise us and it comes along when it's not expected. And it's important that loved ones know what people are wanting. Do not resuscitate, of course, doesn't mean do not treat. And people often get mixed up with that. It doesn't mean to say you wouldn't be given heart medication or antibiotics. And the do not attempt resuscitation ought to be, as the First Minister said, a dialogue across, particularly with the clinician and the person, whether it's a resident in care homes we're talking about, and their families. And it is much easier to be done in the cool light of day than it is in a matter of extremis. We know that some people find it difficult, but I would be expecting the teams, the clinical teams who are caring for people, to have that in order at all times. And I'm confident that there is no deliberate secrecy in terms of developing that. At times, sometimes people say, well, actually, I didn't have that full open discussion with the clinicians, or I actually wasn't sure that that's what was being said. So we constantly encourage people to look at end-of-life care, to support people at the end of their life with compassion and sensitively, so that the best possible decision is made for that person at all times.
Okay, that concludes the questions for today. So thanks to the journalists, thanks to Robert, our BSL interpreter today, and thanks to Fiona for joining me. Finally, thanks to all of you for joining us again today. Please continue to abide by the advice and the rules encapsulated in facts, and tell as many people as you can the importance of doing likewise. We'll be back here tomorrow at 12:15 for the final update of the week. Until then, thanks for joining us.